Our presentation is on the microbiology of syphilis by Charity Mars and Mason Brookman.
And its cause. Syphilis is a systemic infection caused by a bacteria called Treponema pallidum.
Okay.
Treponema pallidum belongs to the kingdom of bacteria. They are gram-negative, thin, coiled spirochetes.
How is syphilis transmitted? Syphilis is transmitted through sexual contact. That could be oral, anal, or normal intercourse. It's also able to be transferred from mother to unborn fetus. It can be also transmitted during the birthing process. It's a communicable disease. It's communicable and able to be transmitted up to 2 years after a person is infected with it. Sometimes those that are infected can be contagious longer than the 2-year period. It depends on the infectious lesions. Sometimes lesions are present and sometimes they are not to the visible eye.
There's 4 stages of syphilis, and they are known as primary, secondary, latent, and tertiary. Each stage has its own signs and symptoms of the infection or lack thereof. So primary stage usually begins 2 to 12 weeks after exposure. It has symptoms of painless, firm sores called chancre on the mouth or the genitals, and swollen lymph nodes.
The secondary stage of syphilis follows 2 to 10 weeks after the primary stage, and it can last up to 2 years. The symptoms are reddish-brown rashes on the palms of the hands and feet. It can also have flu-like symptoms, swollen lymph nodes, hair loss, sore throat.
So the latent stage, it can last years or decades. It usually has symptoms, or actually it has no symptoms during this phase of infection. So the tertiary stage can last for decades. It can be permanently disabling or fatal symptoms like stroke, dementia, loss of coordination, numbness, paralysis, blindness, deafness, or heart disease.
Due to syphilis being caused by a bacteria, antibiotic therapy is required for treatment. The preferred treatment for all patients in all stages is penicillin. It can be given perientally. Dosage and length of treatment depends on the severity and stage of the infection. If a patient is allergic to penicillin, doxycycline or tetracycline could be the replacement therapy.
When syphilis goes untreated, neurosyphilis, ocular syphilis, and autosyphilis can occur. Neurosyphilis is when the infection spreads to the brain and nervous system. Signs and symptoms of neurosyphilis can include severe headaches, muscle weakness, or trouble with muscle functions, confusion, trouble focusing, personality changes, and dementia. Ocular syphilis is when the infection spreads to the eyes. Signs and symptoms can include eye pain or redness, changes in your vision, or even blindness.
Syphilis is when the infection spreads to the ears and can cause hearing loss, ringing, buzzing, roaring, and hissing in the ears. Sometimes dizziness or vertigo can also occur.
Risk factors and prevention for syphilis. Being sexually active and not practicing safe sex is one of the biggest things. Gay or bisexual men are at a higher risk of infection, and social, cultural, and ethnic dependencies.
Prevention of syphilis basically is being in a monogamous relationship, only having sexual contact with one partner, the proper use of condoms and barriers during every sexual encounter, just things of those natures.